Come monsoon, it brings in a lot of cheers definitely in regions of North India especially, where monsoon is usually not heavy, but along with this, when the monsoon is there, comes the fear of certain diseases like dengue, which are seasonal, post-monsoon typically. Parents are really concerned and worried, so they should know how does dengue affect children typically and what are the early symptoms and warning signs that they should be watching for. So if you look at dengue, it's a very dry kind of illness. It starts with abrupt, sudden onset of high-grade fever. The child is miserable, a lot of body ache, nausea, abdominal pain, retching, vomiting, is barely able to lie down and sleep, does not really respond to reasonable antipyretics. Some of them do have a rash which is there in the body. Some of them may complain of an itchy kind of throat which may be there. The headache is so severe and the body pain is of that intensity that clinically sometimes we call it a breakbone kind of fever. So typically these mosquitoes, which is Aedes aegypti, is a day biter, so-called. So children do have to wear full sleeves, especially during these seasons, to avoid too much of mosquito bites as far as possible. Now, if at the family stage or at the household stage, if you have to prevent dengue, I told you, children should start wearing full sleeve dresses. You should not allow water to get accumulated in any of the gardens or any kind of old utensils lying in the open. Waterlogging should be prevented. Proper sanitation facilities should be there. At the society level, if the municipal corporation is active by proper desilting of drains and other things, and anti-fogging activities, mosquito activities are there, which should be undertaken at the onset of monsoon. That should help us in preventing these kind of diseases in the future. There is also a vaccine available as far as dengue is concerned, which is a 4-valent vaccine. Can be given for children between 9 and 16 years of age. It's a 3-dose schedule at 0, 6 and 12 months. Reasonably effective vaccine. It's about 70% efficacious. But you also have to remember there are 4 types of viruses which are commonly in circulation. The infection with one does not give you protection against the other. So you could have more than 1 episodes of dengue in the same patient as well. Not really in that particular season, but in different seasons. So if you're able to take these kind of anti-mosquito bite measures and prevent waterlogging and sanitation measures, along with a good vaccination, and God forbid, if you do get these kind of symptoms, reach the medical fraternity early, you'll be able to prevent severe dengue and hospitalizations in children.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.